Lewisham CCG is responsible for planning, buying and monitoring NHS services with money from central government aimed at improving health of people in Lewisham. Our aim is to secure the best possible health and care for everybody in Lewisham. This film shows some of the work that we've been involved with.
I'm delighted that through the ratings that we get awarded by NHS England, who are our regulator, I'm delighted to say that we moved from requires improvement to good as a CCG this year, which is great praise to all our staff, to our GP members and to our providers that we work very closely with, as well as the local authority. What epitomises good commissioning in the NHS for me is that we do the right things for our local population. So as you know, Lewisham is a very diverse population with lots and lots of health needs. So we work very closely with the local authority to think about how we prevent ill health, as well as working with service providers, or GPs, mental health providers, hospital providers, to give patients the best treatment when they need that treatment. We want to make sure that we spend the right amount of resource to prevent, in the longer term, ill health and cost and burden on society and on the NHS. But I'm pleased to say we didn't exceed our resource limit. So we spent the money that Parliament gave to us through NHS England, and we didn't have any deficits. And we work closely with our providers to make sure that the money that they are given is spent on frontline services as much as possible and improving outcomes for our local people. But I'm aware that there are differences still across Lewisham, and we need to continue to work, particularly with people from Black, Asian, minority ethnic groups, to support them probably more than we're doing now. So we involve the local community in our thinking, in our planning and our design of services through a range of mechanisms. We've got active patient reference groups, both across the CCG, and then we work also with other groups and community groups in Lewisham, connected to GP practices across our neighbourhoods, working with council arrangements, so ward assemblies, talking to people through other festivals. So we have tents and stalls where we provide health advice, as well as talk to individuals about sort of their condition or what's going on for them.
Discharge to Assess is about funding and supporting people to leave hospital when safe and appropriate to do so, and continuing their care and assessment out of hospital. They can then be assessed for their longer term needs in the right place.
And research has shown that the longer people stay in hospital, the more they deteriorate. The health outcomes of these people also reduces. So what the service aims to do is get them out as soon as they are medically ready to be discharged, and then facilitate their support network at home, either be putting in care calls or signposting them to independent organizations like Aid Concern, setting up them up with shopping or befriending service and things like that, to keep them at home. Because we discovered that when you do that for most patients, especially the older people, then the care calls they need long term is actually reduced. In the pathway really works, it makes a difference, because the risk for patients is risk of acquiring hospital-acquired infections, deteriorating in their mobility and stuff like that, and being able to make that difference early on, so that then they are out of the acute setting, they regain their independence.
Diabetes is becoming a very big topic because the prevalence keeps increasing and increasing and increasing. And in Lewisham we have a high prevalence compared to national average anyway. I mean, diabetes is relatively asymptomatic, so people aren't really aware that their sugars are high for quite a long time. It's only when something drastic happens, or the sugars become so high that they start to become symptomatic, that they'll present to the doctor often. We've got very intelligent searches that help identify the patients who need chasing or need extra input into their care, the ones who are not controlled. And it also helps us to identify the patients who would benefit the most from an intervention. And we've seen some great results with just 1 or 2 contacts, because diabetes can be difficult. A patient comes in and you're telling them a lot of bad news about what they can't eat and they can't do this and they must do more exercise. You know, you're telling them to change a lot of their lifestyle, and if you're not doing that, you're giving them more medications with more side effects and complications with it. 3 years ago or so, Lewisham was an outlier for diabetic care. It was considered to not be performing very well. I think last year or the year before we were rated as outstanding for diabetes, so we've come up quite a lot.
The majority of patients at the moment have a cough, a cold, a headache, a sneeze, a wheeze, straight to their GP. Great, because the GP can still provide them with that care, but they're not the only person that can provide them with that care. As a healthcare team, we can, as pharmacists, as nurses, as doctors, we can work together to provide care and allow patients to access care quickly, and also use resources effectively.
So palliative care is the holistic care of someone who is facing a life-limiting illness, so who is approaching the end of their life, where there's no possible cure for that illness. The need to provide ongoing care is paramount. And as well as supporting the patient, we also are there to support the patient's family and loved ones. We have experts available 24 hours a day who can visit patients at home anytime, day or night, any day of the week. And so I think for the residents of Lewisham that is a big change, and in the last year we now provide that level of care for all patients across the whole borough of Lewisham.
SAIL is a quick and easy social prescribing service for people over the age of 60 living in Lewisham. SAIL, or Safe and Independent Living, is a project hosted by Age UK Lewisham and Southwark that acts as the bridge between older people and the local services that can help them. Through a partnership that works across the borough, SAIL offers support to older people in a variety of areas in which they might need help. We're here to help older people get access to the range of support that they need. People can self-refer, or professionals can refer them into the service.
The purpose of the cafe is to deliver mental health support for patients that are unlikely to be admitted into a ward but need some holistic support with the aid of South London Maudsley and an agency called Solidarity in Crisis, whose target will be to support and help these people into returning to their lives and to be able to manage their crisis.
Parents, I think a lot of parents hadn't been getting the 48-hour reviews. I think not only because of lack of GP appointments, but I think once they sometimes get home and they see that their child's okay, they think, oh, they're okay, I'm not going to bother the GP and waste an appointment. But because we ring them and contact them, say, we need to follow you up, and a lot of them haven't had them before, so actually then do find it really useful that they've had their child checked over and that everything's okay, and they feel more reassured.
The patients that we see for the 48-hour reviews, the parents are always quite grateful for the time that we have with them, so we have much longer, so we have 30 minutes with them. It's not always just a one-off visit, so we talk to them, educate them really as well, and the parents as well on how to use the different inhalers, and it might be something quite small, like they're not using the inhaler correctly, or a small change in the dose of medicine, and then they won't be going to A&E as much.
So specialist nursing is becoming more common. So I think this was the first sort of step at getting a specialist team, and hopefully there will be more for different specialities. We came in sort of after it had all been commissioned, and obviously there were posts to fill, because we literally started from scratch, so to see where we started and now where we've got to, and sort of the numbers we're getting through and the improvements we're making, and we have not stopped completely, but reduced the number of A&E attendances. It is, I think, quite a big achievement.
What we do know is that people who end up spending a long time in hospital also have a lower life expectancy. So we've looked at ways how the length of stay in hospital can be reduced, and certainly over the last year with stroke services, the time that people now spend in hospital has been almost halved, and I think that's a tremendous success. I would like to actually thank my colleagues, and this involves not just our clinical colleagues in general practice, which of course includes nurses, but the new types of practitioners that are coming in, for instance the clinical pharmacists, the paramedics, the physicians associates, but also our colleagues in social care. I think medicine isn't about just prescribing pills for people or making sure that they have a bandage on their cut. This is about preventative healthcare. So a happy and well-balanced population will also be a healthy population, and we have worked with the council to encourage people to lead healthy lives.